2700 plus exam like NCLEX practice questions and prep tools, RN and PN adaptive quizzes, NG and case studies. Pass your nursing exam on the first try. Question 1. The nurse is collecting a nutritional history on a 28-year-old female client with iron deficiency anemia and learns that the client likes to eat white chalk. When implementing a teaching plan, the nurse should explain that this practice will do which of the following? Option A. Will bind calcium and therefore interfere with its metabolism. Option B. Will cause more premenstrual cramping. Option C. Interferes with iron absorption because the iron precipitates as an insoluble substance. Option D. Causes competition at iron receptor sites between iron and vitamin B1. The correct answer is option C. Interferes with iron absorption because the iron precipitates as an insoluble substance. Pica, such as eating chalk, involves non-food substances that chemically bind with dietary iron in the gastrointestinal tract. This renders the iron completely insoluble, forcing it to be excreted rather than absorbed, thereby severely worsening her iron deficiency anemia. Question 2. Which of the following laboratory data is representative of a client with aplastic anemia? Option A. A hemoglobin 9.2, hematocrit 27, red blood cells 3.2 million. Option B. White blood cells 4,000, erythrocytes 2.5 million, thrombocytes 100,000. Option C. White blood cells 3,000, hematocrit 27, red blood cells 2.8 million. Option D. Red blood cells 1 million, white blood cells 1,500, thrombocytes 16,000. The correct answer is option D. Red blood cells 1 million, white blood cells 1,500, thrombocytes 16,000. Aplastic anemia is a catastrophic failure of the bone marrow to produce all blood cell lines. It is classically and terrifyingly defined by profound pancytopenia, severe anemia with red blood cells under 1 million, severe leukopenia, and severe thrombocytopenia under 20,000. Question 3. A 20-year-old male client is being treated for protein deficiency. If he likes all of the following foods, which one would the nurse recommend to drastically increase in the diet? Option A. Cantaloupe. Option B. Rice. Option C. Chicken. Option D. Green beans. The correct answer is option C. Chicken. Chicken is an exceptionally rich, high-quality source of complete protein. Furthermore, it is naturally packed with vitamin B6, which is a vital coenzyme absolutely required for adequate protein synthesis and amino acid metabolism in a protein-deficient client. Question 4. A client states to his nurse that he was told by the doctor not to take one of his drugs because it seems to have caused decreasing blood cells. Based on this information, which drug might the nurse expect to be discontinued? Option A. Prednisone. Option B. Timolol maleate. Option C. Gentamicin. Option D. Phenytoin. The correct answer is option D. Phenytoin. Phenytoin is an anticonvulsant medication that carries a severe, well-documented, and terrifying risk of triggering catastrophic blood dyscrasias, most notably bone marrow suppression leading to fatal aplastic anemia, mandating immediate discontinuation if blood counts plummet. Question 5. 48 hours after a thyroidectomy, a female client complains of numbness and tingling of the toes and fingers. The nurse notes upper arm and facial twitching. The nurse needs to do which of the following? Option A. Report the findings to the physician. Option B. Assist the client to do range of motion exercises. Option C. Check the client's potassium level. Option D. Administer the as-needed dose of phenytoin. The correct answer is option A. Report the findings to the physician. Severe numbness, tingling, and alarming facial twitching 48 hours post-thyroidectomy are the absolute, classic, screaming red flags of impending, lethal hypocalcemic tetany caused by accidental removal of the parathyroid glands. This requires immediate, emergency administration of intravenous calcium gluconate by the physician. Question 6. The nurse is admitting a client with folic acid deficiency anemia. Which of the following questions is most important for the nurse to ask the client? Option A. Do you take aspirin on a regular basis? Option B. Do you drink alcohol on a regular basis? Option C. Do you eat red meat? Option D. Have your stools been normal? The correct answer is option B. Do you drink alcohol on a regular basis? Folic acid deficiency anemia is profoundly and inextricably linked to chronic, severe alcohol abuse. Alcohol ruthlessly destroys the intestinal mucosa's ability to absorb folic acid and massively accelerates its renal excretion, making this the most critical historical question. Question 7. An 18-month-old child has been playing in the garage. His mother brings him complaining of a sore mouth. His lips and mouth are soapy and white, with small ulcerated areas beginning to form. He is vomiting with a rapid, weak pulse. The nurse suspects which of the following? Option A. Inhaled gasoline fumes. Option B. Ingested caustic alkali. Option C. Eaten construction chalk. Option D. Lead poisoning. The correct answer is option B. Ingested caustic alkali. The terrifying presentation of a soapy, white, violently burned and ulcerated mouth in a child who was unsupervised in a garage is the absolute hallmark, unmistakable chemical signature of having swallowed a highly corrosive, flesh-destroying caustic alkali. Question 8. In discussing the plan of care for a child with chronic nephroses with the mother, the nurse identifies that the primary purpose of weighing the child daily is to do which of the following? Option A. Measure adequacy of nutritional management. Option B. Check the accuracy of the fluid intake record. Option C. Impress the child with the importance of eating well. Option D. Determine changes in the amount of edema. The correct answer is option D. Determine changes in the amount of edema. Children with chronic nephroses suffer from massive, relentless, total body edema. Strict, accurate daily weights are the absolute, most sensitive, and critical clinical parameter to evaluate dangerous fluid shifts and explicitly determine exact changes in the amount of retained fluid. Question 9. The parents of a 9-year-old child with acute lymphocytic leukemia expressed intense concern about his alopecia from cranial irradiation. The nurse explains which of the following? Option A. Alopecia is an unavoidable side effect. Option B. There are several wig makers for children. Option C. Most children select a favorite hat to protect their heads. Option D. His hair will grow back in a few months. The correct answer is option D. His hair will grow back in a few months. Alopecia is deeply traumatizing to a school-age child. Providing the absolute, concrete reassurance that the hair loss is strictly temporary and that his hair will reliably grow back in a few months provides immense, vital psychological comfort and hope to both the child and parents. Question 10. Loss of appetite for a child with leukemia is a major recurrent problem. The plan of care should be designed to accomplish which of the following? Option A. Reinforce attempts to eat. Option B. Help the child gain weight. Option C. Increase his appetite. Option D. Make mealtimes pleasant. The correct answer is option A. Reinforce attempts to eat. For a severely nauseated, exhausted leukemic child, forcing them to eat triggers massive resistance. The absolute most successful behavioral intervention is to completely ignore refusals and positively, aggressively reinforce and reward any and all actual attempts to eat, no matter how small. Question 11. The mother of a child taking phenytoin will need to plan appropriate mouth care to combat gingival hyperplasia. When tooth brushing is contraindicated, the next most effective cleansing and gingival stimulation technique would be which of the following? Option A. Using a water pick. Option B. Rinsing with water. Option C. Rinsing with hydrogen peroxide. Option D. Rinsing with baking soda. The correct answer is option A. Using a water pick. Phenytoin causes massive, aggressive overgrowth of the gums. If brushing is too painful or contraindicated, a water pick provides a forceful, pulsating stream of water that effectively cleanses the teeth while simultaneously providing the intense, deep gingival stimulation absolutely required to combat the hyperplasia. Question 12. When planning care for a 9-year-old client, the nurse uses which of the most effective means of helping siblings cope with their feelings about a brother who is terminally ill? Option A. Open discussion and understanding. Option B. Play acting out feelings in different roles. Option C. Storytelling. Option D. Drawing pictures. The correct answer is option B. Play acting out feelings in different roles. Children often lack the mature vocabulary to express agonizing grief. Assuming different roles allows them a safe, displaced psychological shield to actively, physically act out their terrifying feelings and massive fears of abandonment without any fear of reprisals, granting them vital insight and control. Question 13. During the active phase of rheumatic fever, the nurse teaches parents to assist in minimizing excruciating joint pain and promoting healing by doing which of the following? Option A, putting all joints through full range of motion twice daily. Option B, massaging the joints briskly with lotion or liniment after a bath. Option C, immobilizing the joints in a functional position using splints, rolls, and pillows. Option D, applying warm water bottles or heating pads over involved joints. The correct answer is option C, immobilizing the joints in a functional position using splints, rolls, and pillows. In the acute phase of rheumatic fever, the joints are massively, violently inflamed and agonizingly painful to even the slightest touch. The absolute, paramount intervention is to completely, strictly immobilize the joints in a neutral, functional position using splints and pillows to allow them to rest and heal. Question 14. The initial focus when providing nursing care for a child with rheumatic fever during the acute phase of the illness should be to do which of the following? Option A, maintain contact with her parents. Option B, provide for physical and psychological rest. Option C, provide a nutritious diet. Option D, maintain her interest in school. The correct answer is option B, provide for physical and psychological rest. The child's heart and joints are under massive, devastating inflammatory attack. The absolute, supreme, non-negotiable medical priority during the acute phase is enforcing strict, profound physical and psychological bed rest to drastically slash cardiac workload and allow the body to desperately heal. Question 15. During discharge planning, parents of a child with rheumatic fever should be able to identify which of the following is classic toxic symptoms of high-dose sodium salicylate. Option A, tinnitus and nausea. Option B, dermatitis and blurred vision. Option C, unconsciousness and acetone odor of the breath. Option D, chills and an elevation of temperature. The correct answer is option A, tinnitus and nausea. Children with rheumatic fever are given massive, anti-inflammatory doses of salicylates. The parents must be rigorously drilled to instantly recognize severe, ringing tinnitus in the ears and relentless nausea as the absolute, hallmark early warning signs of dangerous salicylate toxicity. Question 16. Parents of a child with rheumatic fever express deep concern that she will always be arthritic. The nurse discusses their concerns and tells them the severe joint pain usually behaves in which of the following ways? Option A, subsides in less than 3 weeks. Option B, is relieved by aspirin. Option C, is responsive to ibuprofen. Option D, is subsides in 3 to 6 days. The correct answer is option A, subsides in less than 3 weeks. The nurse provides massive relief by explaining that while the polyarthritis is intensely agonizing, it is absolutely, strictly temporary and benign, leaving no permanent joint damage, and will completely, naturally subside as the acute disease runs its course in less than 3 weeks. Question 17. In caring at home for a child who just ingested a caustic alkali, the nurse would immediately tell the mother to do which of the following? Option A, give vinegar, lemon juice, or orange juice. Option B, phone the doctor. Option C, take the child to the emergency room. Option D, induce vomiting. The correct answer is option A, give vinegar, lemon juice, or orange juice. The immediate, desperate emergency action is to instantly neutralize the violent, flesh-eating chemical action of the strong alkali before it catastrophically burns through the esophagus. Providing a mild acid like vinegar, lemon, or orange juice immediately acts to chemically neutralize the alkali. Question 18. The most important goal in the care plan for a child who was hospitalized with an accidental overdose would be to do which of the following? Option A, determine the child's activity pattern. Option B, reduce the mother's sense of guilt. Option C, instruct parents in the use of Ipecac. Option D, teach parents appropriate safety precautions. The correct answer is option D, teach parents appropriate safety precautions. While treating the current overdose is the acute medical priority, the absolute most important, overarching, long-term nursing goal is fiercely educating the parents on meticulous, foolproof safety precautions and childproofing to guarantee this terrifying, potentially lethal accident is completely prevented from ever recurring. Question 19. A 4-year-old has an imaginary playmate, which highly concerns the mother. The nurse's best response would be which of the following? Option A, I understand your concern and will assist you with a referral. Option B, try not to worry because you will just upset your child. Option C, Just ignore the behavior and it should disappear by age 8. Option D. This is appropriate behavior for a preschooler and should not be a concern. The correct answer is option D. This is appropriate behavior for a preschooler and should not be a concern. The nurse must immediately and confidently reassure the mother that having an active, vivid imaginary playmate is an incredibly normal, healthy, and exceptionally common developmental milestone for a highly imaginative, growing 4-year-old preschooler. Question 20. Parents should be taught absolutely never to prop the bottle when feeding their infants. In addition to the massive risk of choking, it puts the infant at direct risk for which of the following? Option A. Otitis media. Option B. Asthma. Option C. A conjunctivitis. Option D. Tonsillitis. The correct answer is option A. Otitis media. Because a supine infant's eustachian tube is short, wide, and perfectly straight, propping a bottle allows the sugary formula to violently pool in the back of the throat and flow directly into the middle ear, creating a massive, perfect breeding ground for severe, chronic otitis media infections. Question 21. When assessing a female child for Turner's syndrome, the nurse observes for which of the following classic symptoms? Option A. Tall stature. Option B. Amenorrhea. Option C. Secondary sex characteristics. Option D. Gynecomastia. The correct answer is option B. Amenorrhea. Turner's syndrome is a devastating chromosomal abnormality where a female is missing an X chromosome. This causes catastrophic ovarian failure, meaning the child will not undergo puberty, absolutely resulting in primary amenorrhea and a total lack of secondary sexual development. Question 22. The mother of a 2-year-old diagnosed with asthma asks what early symptoms she should look for. The nurse instructs her to watch for which of the following? Option A. Fever, runny nose, and hyperactivity. Option B. Changes in breathing pattern, moodiness, fatigue, and edema of eyes. Option C. Fatigue, dark circles under the eyes, changes in breathing pattern, glassy eyes, and moodiness. Option D. Fever, cough, paleness, and wheezing. The correct answer is option C. Fatigue, dark circles under the eyes, changes in breathing pattern, glassy eyes, and moodiness. Long before the classic wheezing erupts, the child's body begins fighting for oxygen. The mother must be hyper-vigilant for the subtle, early warning signs of creeping hypoxia, profound fatigue, dark circles, glassy eyes, distinct changes in breathing rate, and sudden, unexplained moodiness. Question 23. A 3-year-old female client is brought into the pediatric clinic because she limps. The nurse practitioner describes the limp as a Trendelenburg gait. This gait is characteristic of which of the following? Option A. Scoliosis. Option B. Dislocated hip. Option C. A fractured femur. Option D. A fractured pelvis. The correct answer is option B. Dislocated hip. A Trendelenburg gait is the absolute, classic, diagnostic hallmark of a unilaterally dislocated hip. Because the hip joint is completely unstable, the pelvis violently drops downward on the unaffected side every single time the child bears weight on the dislocated limb, causing a distinct, plunging limp. Question 24. A child has a nursing diagnosis of fluid volume excess related to compromised regulatory mechanisms. Which of the following nursing interventions is the most accurate measure to include in his care? Option A. Weigh the child twice daily on the same scale. Option B. Monitor intake and output. Option C. Check urine-specific gravity of each voiding. Option D. Observe for edema. The correct answer is option A. Weigh the child twice daily on the same scale. While input and output logs are highly prone to human error, rigidly weighing the child twice a day on the exact same scale provides the absolute most sensitive, irrefutable, and scientifically accurate data to track the precise accumulation or loss of dangerous fluid volume. Question 25. The pediatric nurse charts that the parents of a 4-year-old child are very anxious. Which observation would indicate to the nurse unhealthy coping by these parents? Option A. Discussing their needs with the nursing staff. Option B. Discussing their needs with other family members. Option C. Seeking support from their minister. Option D. Refusing to participate in the child's care. The correct answer is option D. Refusing to participate in the child's care. Total, absolute refusal to participate in the sick child's care is a massive red flag indicating a paralyzing, destructive level of denial and overwhelming, unhealthy anxiety, completely isolating the parents and leaving the child emotionally abandoned. Question 26. A 9-week-old female infant has been admitted after surgical repair of a bilateral cleft lip. Which of the following nursing interventions would be appropriate during the first 24 hours? Option A, position on side or abdomen. Option B, maintain elbow restraints in place unless she is being directly supervised. Option C, clean suture line every shift. Option D, offer pacifier when she cries. The correct answer is option B. Maintain elbow restraints in place unless she is being directly supervised. The fresh, delicate facial sutures are in extreme danger of being ripped open by the infant's hands. The absolute, non-negotiable standard of care is to relentlessly maintain rigid elbow restraints, keeping the arms straight so she cannot physically reach her face, removing them only under direct, unbroken supervision. Question 27. A 6-month-old infant with a ventricular septal defect was admitted with failure to thrive. A cardiac catheterization reveals congestive heart failure. Which nursing diagnosis should have the absolute highest priority? Option A, altered nutrition less than body requirements related to inability to take in adequate calories. Option B, altered growth and development related to decreased intake of food. Option C, activity intolerance related to imbalance between oxygen supply and demand. Option D, decreased cardiac output related to ineffective pumping action of the heart. The correct answer is option D, decreased cardiac output related to ineffective pumping action of the heart. Decreased cardiac output is the ultimate, catastrophic root cause. The heart's massive failure to effectively pump oxygenated blood directly starves the entire body, triggering a deadly cascade that causes the profound exhaustion, devastating activity intolerance, and the resulting severe failure to thrive. Question 28. A 9-year-old child was in an explosion and has split thickness and full thickness burns over 40% of his upper body, face, neck, and arms. Which of these nursing diagnoses should have top priority during the first 24 to 48 hours? Option A, pain related to tissue damage from burns. Option B, potential for infection related to contamination of wounds. Option C, fluid volume deficit related to increased capillary permeability. Option D, potential for impaired gas exchange related to edema of the respiratory tract. The correct answer is option D, potential for impaired gas exchange related to edema of the respiratory tract. Burns to the face and neck from a fiery explosion guarantee that the child inhaled superheated, scorching gas. The absolute, terrifying, and immediate life or death priority is anticipating the rapid, massive, and catastrophic swelling of the respiratory tract that will completely obliterate his airway. Question 29. A female baby was born with talipes equinovarus. Her mother has requested that the nurse come to her room to discuss the baby's condition. What should the nurse do first? Option A, call the orthopedist and request that he come to see the baby now. Option B, question the mother and find out what the pediatrician has told her about the baby's condition. Option C, tell the mother that this is not a serious condition. Option D, tell the mother that this condition has been successfully treated with exercises, casts, and braces. The correct answer is option B. Question the mother and find out what the pediatrician has told her about the baby's condition. Before the nurse can safely or effectively educate the mother, she must first expertly assess exactly what the mother already knows or has been told by the physician, establishing an accurate baseline to prevent giving contradictory, confusing, or overwhelming information. Question 30. Cystic fibrosis is transmitted as an autosomal recessive trait. This genetic mechanism means which of the following? Option A, mothers carry the gene and pass it to their sons. Option B, fathers carry the gene and pass it to their daughters. Option C, both parents must have the disease for a child to have the disease. Option D, both parents must be carriers for a child to have the disease. The correct answer is option D, both parents must be carriers for a child to have the disease. Autosomal recessive inheritance is a strict genetic law. It absolutely demands that for a child to actually manifest the devastating disease of cystic fibrosis, they must inherit 2 copies of the defective gene, meaning both the mother and the father must undeniably be silent carriers of the exact same mutation. Question 31. Diabetes mellitus is characterized by an absence of, or marked decrease in, circulating insulin. When teaching a newly diagnosed diabetes client, the nurse includes which of the following is the primary functions of insulin? Option A, a transport of glucose into body cells and storage of glycogen in the liver. Option B, a glycogenolysis and facilitation of glucose use for energy. Option C, glycogenolysis and catabolism. Option D, catabolism and hyperglycemia. The correct answer is option A, transport of glucose into body cells and storage of glycogen in the liver. Insulin is the absolute, vital key that unlocks the cell membrane, actively transporting circulating glucose out of the blood and straight into the body cells for immediate energy, while simultaneously commanding the liver to hoard and store massive amounts of glucose as glycogen. Question 32. A 14-year-old boy takes 30 units of NPH insulin and 10 units of regular insulin every morning at 7 o'clock. He eats breakfast at 7:30 and lunch at noon. What time should he expect the greatest risk for hypoglycemia? Option A, 9 in the morning. Option B, 1 in the afternoon. Option C, 11 in the morning. Option D, 3 in the afternoon. The correct answer is option C, 11 in the morning. Regular insulin is a short-acting beast that violently peaks exactly 2 to 3 hours after injection. Given at 7 in the morning, it will reach its absolute, most powerful, and dangerous maximum blood sugar crashing effect right at 11 in the morning, just before he is able to eat his lunch. Question 33. A 16-year-old diabetic girl asks if she should increase her insulin when she is planning to attend cheerleading practice sessions lasting from 8 to 11 in the morning. The most appropriate answer would be which of the following? Option A, you should ask your doctor about this. Option B, yes, increase your insulin by 1 unit for each hour of practice because exercise causes the body to need more insulin. Option C, no, do not increase your insulin. Exercise will not affect your insulin needs. Option D, no, do not increase your insulin, but eating a snack prior to practice will make insulin more effective and move more glucose into the cells. The correct answer is option D, no, do not increase your insulin, but eating a snack prior to practice will make insulin more effective and move more glucose into the cells. Intense physical exercise is a massive metabolic furnace that rapidly burns glucose and drastically amplifies the efficiency of existing insulin. She must absolutely not increase her insulin, but must proactively consume a high-energy snack beforehand to prevent a catastrophic, exercise-induced hypoglycemic crash. Question 34. The physician decides to prescribe both a short-acting insulin and an intermediate-acting insulin for a newly diagnosed diabetic client. An example of a short-acting insulin is which of the following? Option A, Novolin Regular. Option B, Humulin NPH. Option C, Lente Beef. Option D, Protamine Zinc Insulin. The correct answer is option A, Novolin Regular. Regular insulin, commonly branded as Novolin Regular or Humulin R, is the absolute standard, fast-hitting, short-acting insulin preparation universally used to rapidly knock down spiking blood glucose levels, particularly around mealtimes. Question 35. When preparing insulin for intravenous administration in a critical care setting, the nurse identifies which kind of insulin as the only safe option to use. Option A, NPH. Option B, human or pork. Option C, regular. Option D, long-acting. The correct answer is option C, regular. Regular insulin is the absolute, one and only type of insulin that is chemically pure, clear, and perfectly formulated to be safely and rapidly administered directly into the bloodstream via the intravenous route without causing catastrophic emboli or unpredictable absorption. Question 36. A 33-year-old client is being evaluated for treatment with lithium for bipolar disorder. Which of the following diagnostic tests are absolutely essential prior to the initiation of lithium therapy with this client? Option A, hematocrit, hemoglobin, and white blood cell count. Option B, blood urea nitrogen, electrolytes, and creatinine. Option C, glucose tolerance test, and random blood sugar. Option D, X-rays, electroencephalogram, and electrocardiogram. The correct answer is option B, blood urea nitrogen, electrolytes, and creatinine. Lithium is a highly toxic salt that is exclusively and rigorously cleared from the body by the kidneys. Therefore, obtaining baseline blood urea nitrogen, electrolytes, and creatinine is an absolute, non-negotiable mandate to guarantee flawless renal function before administering this potentially lethal drug. Question 37. A client has been taking lithium 300 mg orally twice a day for 2 weeks. This morning her lithium level was 1.0 milliequivalents per liter. The nurse should do which of the following? Option A. Notify the physician immediately. Option B. Hold the morning lithium dose and continue to observe the client. Option C. Administer the morning lithium dose as scheduled. Option D. Obtain an order for benztropine. The correct answer is option C. Administer the morning lithium dose as scheduled. A lithium blood level of 1.0 is absolutely, perfectly nestled right in the middle of the strict therapeutic range of 0.8 to 1.2. The nurse must confidently and routinely administer the scheduled morning dose to seamlessly maintain this ideal, highly effective blood concentration. Question 38. A male client is admitted to the chemical dependency unit. He reports that the last time he drank was 3 days ago, and that now he is starting to feel kind of shaky. Based on this information, nursing care goals for this client will initially focus on which of the following? Option A is self-concept problems. Option B, interpersonal issues. Option C, ineffective coping skills. Option D, physiological stabilization. The correct answer is option D, physiological stabilization. At exactly 3 days post-abstinence and presenting with escalating tremors, the client is in the terrifying, lethal crosshairs of severe alcohol withdrawal and impending delirium tremens. The absolute, overriding, life-or-death priority is aggressive medical and physiological stabilization to prevent fatal seizures and cardiovascular collapse. Question 39. One afternoon 3 weeks into his alcohol treatment program, a client says to the nurse that it is really not his fault he has a drinking problem because alcoholism runs in his family. The nurse's best response would be which of the following? Option A. That might be a problem. Tell me more about them. Option B. Your risk factors can often be controlled by self-responsibility. Option C. It sounds like you are intellectualizing your drinking problem. Option D. Your grandfather and father were both alcoholics. The correct answer is option B. Risk factors can often be controlled by self-responsibility. The client is actively attempting to dodge accountability by hiding behind genetics. The nurse masterfully and therapeutically intercepts this by definitively acknowledging the genetic risk while simultaneously, firmly redirecting the focus entirely back onto his absolute requirement to take rigorous self-responsibility for his recovery. Question 40. A 14-year-old teenager is hospitalized for anorexia nervosa. She is admitted to the adolescent mental health unit and placed on a behavior modification program. Nursing interventions for the teenager will most likely include which of the following? Option A. Establishing routine tasks and activities around mealtimes. Option B. Administering medications such as lithium. Option C. Requiring the client to eat more during meals. Option D. Checking the client's room frequently. The correct answer is option A. Establishing routine tasks and activities around mealtimes. For a terrified anorexic client entirely consumed by the chaotic need for control, the absolute most highly effective behavioral intervention is imposing a rigid, ultra-structured, and utterly predictable routine around mealtimes to massively reduce their agonizing anxiety and foster safe, internal regulation. Question 41. A measurable outcome criterion in the nursing care of an adolescent with anorexia nervosa would be which of the following? Option A. Accepting her present body image. Option B. Verbalizing realistic feelings about her body. Option C. Having an improved perception of her body image. Option D. Exhibiting increased self-esteem. The correct answer is option B. Verbalizing realistic feelings about her body. In clinical nursing, an outcome must be definitively, objectively observable. Verbalizing realistic feelings provides absolute, concrete, audible proof that the client's horrific, distorted cognitive pathology is finally yielding to a healthy, reality-based self-perception, making it the only truly measurable criterion. Question 42. A 23-year-old female client repeatedly makes superficial cuts on her wrists and experiences wide mood swings. She tells the nurse, "Nobody in here seems to really care about the clients. I thought nurses cared about people." The client is exhibiting which ego defense mechanism? Option A. Reaction formation. Option B. Rationalization. Option C, splitting. Option D, sublimation. The correct answer is option C, splitting. The borderline client's aggressive, polarizing statement that nobody cares, while simultaneously idolizing the concept of what a nurse should be, is the absolute, textbook definition of splitting, a devastating defense mechanism where they violently categorize people as either entirely, perfectly good or utterly, irredeemably bad. Question 43. A client hospitalized with adjustment disorder versus personality disorder states that nobody cares about the clients. The nurse's most effective response would be which of the following? Option A. How can you say that I do not care? We just met. Option B. What makes you think the nurses do not care? Option C. You will feel differently about us in a few days. Option D. You seem angry. Tell me more about how you feel. The correct answer is option D. You seem angry. Tell me more about how you feel. This response is a masterclass in psychiatric de-escalation. The nurse brilliantly sidesteps the client's toxic, splitting bait by refusing to be defensive, and instead, expertly reflects the intense underlying emotion of anger, completely disarming the hostility and opening a safe channel for therapeutic ventilation. Question 44. A 45-year-old client diagnosed with major depression is scheduled for electroconvulsive therapy in the morning. Which of the following medications are routinely administered either before or during the therapy? Option A, thioridazine, lithium, and benztropine. Option B, atropine, sodium brevitol, and succinylcholine chloride. Option C, sodium, potassium, and magnesium. Option D, carbamazepine, haloperidol, and trihexyphenidyl. The correct answer is option B, atropine, sodium brevitol, and succinylcholine chloride. This is the absolute, gold standard pharmacological triad for electroconvulsive therapy. Atropine is aggressively given to dry up deadly secretions and block lethal bradycardia, sodium brevitol provides a rapid, deep anesthetic sleep, and succinylcholine is the ultimate muscle paralyzer, completely preventing catastrophic, bone-shattering convulsions during the seizure. Question 45. A 35-year-old client is receiving psychopharmacological treatment with tranylcypromine sulfate, a monoamine oxidase inhibitor. The nurse teaches the client that while he is taking this type of antidepressant, he needs to strictly restrict his dietary intake of which of the following? Option A, potassium-rich foods. Option B, a tryptophan. Option C, tyramine. Option D, saturated fats. The correct answer is option C, tyramine. The nurse must relentlessly, terrifyingly drill into the client that consuming even a trace of tyramine while taking a monoamine oxidase inhibitor will instantly trigger a massive, explosive, and catastrophic hypertensive crisis that can easily culminate in a fatal stroke or myocardial infarction.